On this episode, I'm talking with Michael Coryea. Michael is a board-certified psychiatric mental health nurse practitioner and the CEO and founder of Roadways to Recovery based in Indiana. Michael, welcome to the program.
Thank you.
Tell us a little bit about Roadways to Recovery and the psychiatric mental health services that you provide.
Like you said, we're based in Indiana, to be more specific, more in the Bedford area, although we have expanded out into Terre Haute, Indiana as well. So we just actually purchased a couple buildings there. We provide addiction treatment and mental health services. Our model has been primarily telehealth so far. That's allowed us to reach people all across the state of Indiana, and we've experienced a decent amount of growth in a short period of time due to this. It's very accessible for everybody in the state. People also, in their busy jobs and are able to do it right there at work, which makes it very convenient. Some of the things we provide is not only just mental health services, but we provide addiction services as well. So we provide all the MAT treatment, things like naltrexone with Vivitrol injections, Suboxone. We even do some Sublocade injections in our Anderson partnership, Camprol, et cetera, for those with addiction. And we provide actually programs with an array. We try to go through and fill in all the gaps that come through with mental health and addiction, because there are so many. Unfortunately, there's not great systems that do it all. So we kind of help try to fill that in with our strength, and our big strength is our providers. We have several psychiatric mental health nurse practitioners, which is a big scarcity in the times that we live in at the moment. So we provide, at the residential level, for instance, we have a partnership with a company that does it down there in Henryville, Indiana. We do all their psych prescribing, for instance. We do it all virtual, so they actually do the detox in that location, which we are able to do that as well. But they already had a group that did it. But they're like, Michael, we really need somebody to. We have so many mental health problems with our clients that we're having. The comorbidity rates of those with addiction is so incredibly high. Just PTSD alone, over half of all women, for instance, have PTSD that have addiction. We're not even getting into, all the bipolar, the schizophrenia that we get into, of course, the depression and anxiety that's extremely common. So I said, yeah, you know what? Absolutely. We'd love to help you out with that. And since we've done that, we've only been doing it now for about 2 months. And they said, you know what? We are so thrilled with being able to have these services because our client satisfaction levels have gone up. Our admit, they call it ASA against, I'll be honest. I always call it AMA when it's in the hospital. They call it ASA, but I'll be honest, it's slipping my mind on what ASA is. It's against staff advice. That's what it is instead of medical. But anyway, point being is they turned around and said, hey, our rates are down for this. We don't have we haven't had hardly any crisis for mental health that's been there. They're very limited. Every once in a while we get one on the weekend when you guys aren't there, but it brought it down. So that's one of the big things that we want to be able to offer to other organizations that are doing addiction as well, whenever they have, because we know that that's not an exclusive thing. Most of the people that you treat with addiction have a mental health disorder as well. There's an etiology a lot of times of what is going on, of why they started using drugs in the first place, or if they even started and then they end up in bad situations that ends up putting them in a position where they have problems. So we bring that and try to bridge that gap with mental health and with the addiction realm for those that are already doing addiction. And we also in our group specialize in both doing the detox ourselves as along with the mental health, which we do all this in the outpatient as well. So we have our own outpatient services that we do, and we provide both of those services either exclusively or together with combined with those services. And then we turn around and do it at other levels of care as well. So we work also with another one here in Indiana that's a hospital 4.0. They also do a residential and a PHP level, and we actually do the detox in the hospital along with the mental health. medication management services there. And then we do the psych just for their residential care and their PHP level. And then we have a partnership in Anderson, Indiana, where we also do our own PHP program up there along with IOP programming. So, and then of course, like I had mentioned previously, is that our outpatient services, we do it throughout the state of Indiana. And so all these places that are discharging don't have to sit there and try to search for especially areas where everybody's in. They can actually refer them to us and we can do it anywhere in the state. And it's very convenient for those that a lot of people don't have transportation, for instance, but they have a smartphone and, you know, everybody has a smartphone. So we use the smartphones, able to do it right there on there. We use several different types of media to come through with. So we use Zoom, for instance. We use some of our providers also use some DoxyMe just to be able to get it in. So it's worked very well with it. It's simple. There's a link, click it. It's about all there is to it. So it makes it pretty simple for them. But our big thing, like I said before, was really filling in those gaps as it comes through treatment and doing so effectively and also quickly. You know, when you come out of a program, you know, they may give you 2 weeks of medication. Well, that's not much time to get into a prescriber. We have made it so far where we're able to actually get people in within 2 weeks of time, which is pretty impressive for the landscape if you know anything about it, because most places are 6 weeks to 3 months or more to get into a psychiatric provider. And we do treat children as well. So we actually treat children, adolescents, and adults all through there. So we kind of hit all those age groups.
I understand you're also beginning to introduce in-person services in Greenwood and Bedford this year.
Sorry to correct you on that part, but Greenwood, no.
Okay.
Bedford and Terre Haute, yes.
Okay.
So we do have in Bedford, we have our office that's supposed to be opening up this summer. Same with Terre Haute, we actually just bought that building and we should be having it open this summer as well. So we will have in-person services at that, which, you know, adds a dimension that I think is needed, especially when we're doing PHP and IOP services. I think you really need to have some components of in-person there. And we do it in Anderson, Indiana already. So we have a partnership with Grace Wellness and Recovery, and we do it there. And they actually have a PHP, IOP, and sober living. So they have 70 beds of sober living there. And we actually have now sober living services in Bedford, Indiana, and Terre Haute that are open.